The coronavirus surge has stressed hospitals and healthcare workers in the past month. Florida and Texas are at the center of the spike, accounting for more than 40% of new cases. Florida has had more new cases in a week than 30 other states combined.
However, there could be some good news on the way. I spoke with the leader of Mayo Clinic today. He says Governor Ron DeSantis has it right, that cases seem to be coming down and a certain therapy can make a big difference against the illness. Florida Governor Ron DeSantis made his second visit to Jacksonville this week and announced increased availability of an emergency treatment option. I asked Mayo Clinic Jacksonville CEO Kent Thielen about it. What can you tell us about this monoclonal antibody treatment? And it sounds, from what I've heard from you, that Mayo has kind of been at the forefront of that.
Yes, it's an excellent therapy. It's something that since it first became available in November of 2020, we've been very strong advocates for as an organization nationally, as well as here in Northeast Florida in the Jacksonville area. We've had a clinic that's open on a daily basis to infuse patients with monoclonal antibodies.
Dr. Thielen says the treatment has to come early in the fight against coronavirus. He says it's usually best for patients with underlying health concerns.
It does significantly reduce the chances of those patients going on to need to be hospitalized. It also can reduce the length of their disease severity. And so we think it's an outstanding therapy. We've done over 1,100 patients here since November of 2020. And we have a capacity to treat over 200 patients a week. So we think it's very important.
Earlier in the week, Governor DeSantis made headlines saying he likes the trend he's seeing in cases. CDC data shows Florida reporting a record 24,753 cases Wednesday. But Dr. Thielen agrees the surge could be turning a corner.
What I can say is, while we still are at a very high level, nearly twice the level of where we were in January of 2020, we have seen a plateauing over the last probably 7 to 10 days. And actually over the last few days, we're seeing perhaps some indicators. You never know with a virus like this, but perhaps some indicators that we're actually seeing a decline in the total number of patients. And we've actually have about 5% less patients hospitalized in our hospital with COVID now compared to a week ago.
Dr. Thielen confirmed to me Mayo Clinic has brought in more ventilators during the surge, but he says that they're in what he called a very good position right now from a resource standpoint.